Hi, everyone. Thank you for joining us today for our policy round webinar. I'll just give it a few moments to let others join, and then we will begin shortly. Hi, everyone. Thank you so much for joining us today for our Policy Rounds webinar. So our webinar title is using geographic data. Sorry, something is blocking my screen right now. But I have Dr. Catherine Bigonnesse today, who is the Canada Research Chair in Healthy Aging and the Assistant Professor at the Department of Political Science, University of New Brunswick. So in just a summary of what the policy rounds do. So we share knowledge and insights on aging in technology research, and then we discuss the policy implications. So this is basically what Dr. Bigonnesse is going to do today. And then this helps us to connect with policy stakeholders, partners, older adults, and caregivers. So the presentation is 30 minutes. So in total, the presentation is 30 minutes. The actual presentation is 20 minutes, followed by a Q&A. And then anyone who feels like contributing or asking any questions is free to do so in the Q&A. So I'm just going to hand it over to you, Catherine. You can go ahead. I'll stop the share right now.
All right, thank you, everyone. Thank you for the introduction. So I'm just going to switch to my screen. All right, is there somebody just give me a thumbs up if you're able to see this properly?
I can see okay. Now
same thing as earlier. Hold on. Yes, there you go. Okay.
Yeah.
Fantastic.
Yes, it's okay.
Beautiful. Thank you so much. So hello, everyone. Good afternoon or good morning. I don't know where you are in Canada, but today I'm going to talk about geographic data and how we can use that for policy planning and program development in community that face accelerated aging. As you're all very aware, we are facing population aging in Canada, but the fact is that Atlantic provinces have the fastest aging population in Canada, which give us a lot of challenge in at the level of policy planning at many levels. But just to give you an idea, in the next 20 years, we're going to reach level where the population in New Brunswick, Newfoundland, Labrador, and Nova Scotia and PEI will be extremely high, and the steepest curve is in the next 10 years. So we face a lot of challenges for sure ahead of us. The problem with aging is extremely complex. We know it affects the individual, but at the societal level, there's many sectors that our society that are affected all at the same time. Healthcare is one easy we can think about, but also the sector of employment, housing, transportation, technology, all can be impacted, and it's happening all the same time and extremely fast. So we have to think about population aging and healthy aging in a way that is a bit more broad and comprehensive. However, the challenge is also that policy on aging are developed in silo without a current vision of interconnecting factors. So often ministries work separately, and then the industry that maybe the private industry will also work on their side, and there's never some kind of a overall vision to understand aging properly. Why this is happening specifically, there's mainly 3 reasons. I can provide more, but let's talk about 3. There's no specific framework for analysis in this idea of understanding healthy aging. So there's a lack of coherent framework to guide aging policy and reforms. So that's one thing. The second aspect is there's no data for policymakers. So policymaker want to make good decision and really have no data is easily digestible. There is data out there, but given the time they have to search the information, and there may be the ability to access some database, it's very difficult for them to have a comprehensive view and the right information to make the right decision. And the third reason is there's no older adults engagement in policy research and design and policymaking in general. This is very important too, and it's lacking at this moment. Based on these 3 reasons, the program of the Canada Research Chair in Healthy Aging is really focusing on this aspect, although to try to address those 3 questions. So the goal of the Canada Research Chair in Healthy Aging is to explore the impact of social policy on older adults' health in provinces facing the challenges of accelerated aging population. There's 2 objectives. The first one is to develop policy analysis tools to help decision makers better understand the impact of public policy on the aging population. The second objective is to develop evidence-based healthy aging policies in the Atlantic provinces by using interdisciplinary, intersectoral, and participatory research method. There's 2 entities that are created through the research chair: the Atlantic Observatory on Aging and the Healthy Aging Policy Innovation Lab. The Healthy Aging Policy Innovation Lab is a living lab. We won't talk about this today, but I want you to know it's out there. We will focus on the work of the Atlantic Observatory on Aging today. What are observatories? They are data centers that are created to observe a specific social phenomenon. It uses indicators to monitor changes and variation over time and across regions. Specifically, the purpose of the Atlantic Observatory on Aging is to track indicators to monitor population aging in Atlantic Canada, and to create healthy aging community profiles and interactive maps data visualization for New Brunswick, Nova Scotia, PEI, and Newfoundland. What does it mean exactly? This is kind of what I want to discuss and tease out about what would become in the next few years the Atlantic Observatory on Aging. So this process of the observatory starts with me asking myself, but where exactly are older adults? Because we can have data and stats and whatnot, but there's an experience with aging that is so anchored in the environment, in the context, that we kind of need to start with the point where people live exactly. So this is a map from the census program from Statistics Canada at the level of census subdivision, which is a kind of an aggregate of small areas for the census. But we have, as you can see on the right of the screen, multiple density of percentage of population of seniors, basically, or older adults across Canada, varying from not much to some area with 97.9% of older adults in specific areas. So this is the thing I'm starting to explore is like, okay, where are where people are highly concentrated, like as older adults, so we can think about serving their area first, because there's obviously a higher concentration. Just to be clear, if we look at the data from the census, we have, this is the top 10 census subdivision with the highest percentage of older adults across Canada. So there's a place in Quebec called Notre-Dame-des-Anges that's 97.9% of seniors. So I was like, okay, what's going on in this place? Like, this is extremely high percentage. That it turned out to be a monastery, so it's the census subdivision is exactly the land of the monastery. So this is a population of nuns and monks mainly. That would explain the age. But despite that, across Canada, we already have areas where there's like over 66% of the population is age 65 and over. To me, these are extremely important area where we should first thinking about policy and program, because the population is already there. If we think about per provinces, the number changed a little bit, but compared to the rest of each province, we have also specific area with very high concentration. Obviously, the Northwest Territory, Yukon, and Nunavut are known to have a much younger population. They still have some area, at the exception of Nunavut, having like almost a third of the population in some specific area with a high concentration of people age 65 and over. So this is the distribution across Canada. If you want to know where they are, like I had assumed that maybe they are in like urban areas or people with high density of population. But if we put that on a map, then I don't know if there's any participants in the webinar from those specific provinces, but a lot of them are completely rural. They're a small island. They're in the middle of absolutely nowhere outside of big urban center. So my question is like, okay, why people are actually aging there, and what caused a specific area to age faster than the rest of the population? These are all questions that I think we should all think about. I apologize for people who potentially live in Resolute Bay in just all of the up north. I couldn't fit in my map. But these are really interesting way of looking at aging in context of the geography. So when we think about why am I thinking about geography, and then as kind of an anchor for data, we know that healthy aging in place is impacted by multiple factors, but specifically some of the home environment. It could be the housing type, the neighborhood poverty index, for instance. Support services is also extremely important for individual health, but also the ability to age in place. So we're talking about home support, healthcare services, community-based support services like Meals on Wheels, for instance. Those are essential for people to stay in their home as long as possible. The idea of mobility also, and transportation, like how do you get from point A to point B when you lose your driver's license? This is very impactful for people who live in a rural area where there's no other option than cars. We're talking also about the walkability index, or the how convenient the neighborhood environment is for mobility when you get older. As we very much understand, also aging is also an individual phenomenon. So health is extremely important, but also the fact that you live alone, your immigration status, your language, your income status, all those factors will influence the way you age, your ability to access services, and how you connect with your community around you, and the type of support system that you have. So those data also need to be in there to understand healthy aging and aging in place. And finally, the natural environment is also a key factor in a healthy aging in place. Like we know with climate change, how fast we face extreme weather event, emergency, forest fire, a hurricane in the last few years that have impacted our community to a point that if you're an older adult and you face those circumstances, you're displaced, it's extremely difficult. And you might not be able to actually evacuate in time. So the terrain, the weather, the fact that you live in rural versus urban context will completely change your experience of healthy aging in place. But the question is like, when you take all those factors, they are interesting at a theoretical level, but when you try to cross those information with a geographical area, so a specific location of a village, a subdivision, or a town, then kind of a different portrait. But that data is extremely difficult to find because it's scattered across multiple sources. So if you're interested in the home environment, you will be able to find interesting data. The Canada Mortgage and Housing Corporations, that's Canada, also have some interesting data, but are they linked to postal code or to local area? It's not always the case. You need to process that. If you think about support services, well, some of the data that we have access are only accessible through administrative data from provincial government. Then if you don't have an agreement somehow to access those data, the quality of that data can be sometimes challenging. Then you don't have access to that key information to understand how people are doing in the specific geographical area. Some data don't exist at all. I'm trying right now to put together a database on Meals on Wheels in New Brunswick, who are offering the services, what are the area they're covering. That will require basically that all the nonprofit that are offering a Meals on Wheels program in the province to come together. We're doing this through the Living Lab to basically share their stats, but nothing is comparable. They all use a different like homemade Excel document with different quality of data. Then now we have to work together to uniformize the data and the quality. This is one challenge among many other to put those data together. The municipal, like for mobility transportation, this is another question of like municipal authorities. Tech company, they have like the walkability score, for example, is a private company that have publicly available data, but how do you match that with your geographic data or your maps? It's a different question. Individual characteristics, same thing. There's a lot of data available, including the Canadian Longitudinal Study on Aging, but we still have to process it at the geographical level. And if the sample is too small, then we have a problem with confidentiality that we need to ensure that we're also respecting that. So these are other challenges to if you want to put data on the map, basically. And the same story goes with the natural environment. Environment Canada has some data, StatsCan also, but how do we combine that with the data about older adults and what's their experience of all that is remaining an extremely big challenge. But what does it mean if we can combine all those data anchored into geography? Well, we can plan services like a mobile vaccination clinic in an area with older adults living in apartment complexes, for instance. Or a city will decide to improve the neighborhood walkability in an area where there's a lot of assisted living facility, and like the cross time, for instance, on the corner with the light or the traffic light can be increased from a few seconds, which will make a big difference for mobility for older adults who use assistive devices. Another way of thinking about this is that you can also think about adapting your services. If you find that a local area, there's a high population of immigrants speaking a different language as French or English or First Nation, then you might want to translate your healthcare information document to facilitate access and information about health in that area. You might want to hire staff speaking multiple languages and have appropriate cultural training for those, at least prioritize those areas for your training and for your translation. In the event of a weather emergency, then you can prioritize forest fire evacuation support in areas with older adults living alone. You can also prioritize wellness check in rural areas with older adults after an ice storm of hurricane, which there's 2 cases that happened in Atlantic Canada in the last 5 years. We had a big ice storm, we had a hurricane, multiple of them, and how we make sure that we assist older adults properly. We need to know where they are, basically. So this is a brief overview of the work of the Atlantic Observatory on Aging in the Canada Research in the Healthy Aging. But just to give you some kind of a calendar, this thing basically, anyway, I feel just started, but I started in summer 2022. The lab just opened, so finally got my staff and everything up and running. I'm facing analyzing 4 million data points. That's what it is. This is just the census data at this point that we need to process for at the geographical level. So that's going to take a little while to be able to provide the tool that we can offer to the public. But by the end of the summer, I'm really hoping that I will be able to have developed some kind of basic healthy aging community profiles that can be shared. And somewhere in 2025, having data visualization tool. Basically, I'm thinking about a map, like a Google Map style viewer, where you can enter your community and then have data and stats available for your area, and then plan your services and understand what's happening with the aging population. Need to acknowledge the funders. Thank you very much for everybody's support and technical support. And that's my presentation.
Thank you so much, Catherine. This is very interesting, and I do look forward to having something like a Google Map where I can, access all the adult information based on districts and municipalities. So I don't see any questions right now in the Q&A. Everyone, feel free to plug in your questions if you have thought of anything. I just wanted to find out from you, like, what are your, like right now, what are your current challenges putting together the observatory?
Yeah, the challenge is really about the data, because the different sources make the data are not always compatible. So you have to think about geographic data a little bit differently than the other type of health data, because we're not thinking about an individual, but we're thinking about a unit, a geographic unit. And then you layer data on a different type of information on top of each other. But so sometimes you don't have the postal code or the geographic anchor to be able to place the specific services or the health data. But when you have it, they're not always, you have to understand it. It doesn't mean that, yes, you have a higher percentage of people living with cancer, for instance, or disability. Yes, there's a high percentage of older adults in that area, but it's not linked to the individual. So it's really contextual data. Only a few very powerful database are linking individual with the geographic like postal code, for instance. Basically, I'm sorry, I'm gonna lose my voice. So in that case, those are very powerful database, but they're very rare.
Yeah.
So how you make sure that you get good information that are interesting, contextual data, but also a few key data set that are like very linkable in that way. And this is going to be a lot of work in the next 5 to 10 years for sure.
So we have a question in the Q&A. Can you see it? You are still on silent.
Sorry. Yes, of course. Trying to give you my Google of my water bottle at the same time. Yes, I have worked very closely with age-friendly community in some area. The challenge we have is they're not necessarily trained in research and for collecting data. So the data are not always comparable. Like the case in New Brunswick, for instance, many community have done their own diagnosis of like services and what they needed and whatnot, but it's all different. So how you make sure that if you want to start uniformizing data, like I'm a qualitative researcher at heart, so like I'm absolutely dive into like a community and know everything about them. But when you start to think about large scale data, you make them comparable. But that is for sure partner into the living lab that we are included in the process. Absolutely.
All right. So something has happened here. I see someone wants to answer the question, but anyway, so I haven't got a question. Okay, there we go. I haven't got another question. But maybe in terms of policy implications, how can the observatory be used effectively by policymakers to help older adults, especially those who live in remote areas like rural areas and remote, far from the city, like inside the city areas?
Yeah, this is the main be able to provide policymaker with easy to access information is the key. The Google style viewer is going to be, I hope, as easy as possible to use. So you just collect your information, your location, and your if you're in a village or somewhere, then it doesn't matter. You can have a portrait of your aging population and the services available and the housing and everything. So that is one key element for making this useful for policymakers to plan any type of program or health or whatnot. There's also the profile there are basically little reports with key information about specific community that you can use also for planning. All this will be available I went very quickly through my thank you slide, but there is now a website for the Canada Research Chair on Healthy Aging and the Living Lab that the portal for the data viewer will be available through there. So I hope it will be used as much as possible in the future for policymakers to plan and understand the population they're serving.
Mm-hmm. For sure. So one last thing, maybe Jenna, you have a question. I don't know.
I
What
do.
is
I don't have a question. I have a comment, if that's okay, Norma.
yeah, okay.
And it's not really a question, but I think you might have some further insights on being cognizant of time. But I just wanted to highlight, I found it really interesting on your slides when you presented the top 10 with the census at a community level after the Atlantic table with the Atlantic provinces being kind of the oldest on average. But then this top 10 insight was only Newfoundland was on there, I think twice. And then it was BC and Quebec and Saskatchewan. So, and none of the other Atlantic provinces. So the more granular picture showing at a community level how aging looks different whenever you take that regionalized approach is struck out to me in this and was really fascinating to see that data. I don't know if you want to speak to that in terms of the policy implications that has in and of itself, but I just really appreciated that.
Thank you. And this is what I noticed too. I'm like, okay, but because my area of interest was like really aging in place, not like meaning aging in the same place, but aging the experience of place as you age. And I'm an environmental gerontologist, so it's everything about like environment impacting aging. I'm like, why geography, like why human geography and gerontology is not talking? Like this is such an we need to just have a conversation. It's not completely just there yet. There are geographers thinking about geography, and then there are health researchers that think about individual health, and then there's their gerontologists who are putting everything together-ish, but it's still not completely integrated. And from a policy planning perspective, this is a complete nightmare to be able to decipher all this and policymakers have no time. Like there's other stuff to do. So if it can be easy, accessible, then after that we can complain they're not doing their job. But until they don't have the data available, then you cannot blame anybody if they don't know what's going on because there's no data easy to understand. So that the interest started there. Like, okay, why geography is not part of the conversation? Well, it turned out it's very more complicated than I thought, and it's good. I have like a lot of stuff to do for sure.
There's another question in the Q&A, and I think that will be our last one.
Okay. This value approach will demand we change policies for the way we deliver health and healthcare and services, and also the stereotyping of aging itself. Have you thought about knowledge translation? Yes. Very good question. Yes, it will need a complete overhaul. My approach with this would be to, once the data is available and it's kind of polished and digestible, I want to sit down with policymaker and say, okay, what do you need? Because I'm not a policymaker, I'm a gerontologist. I have an idea of what you could need, but the Living Lab bring this aspect of, okay, around the table, you have all the adults, you have policy planner and maker and researcher around the table. What do you need as an output? And then that will drive the policy translation process, because I don't want to assume that what I'm producing out there is useful. And nobody has time for knowledge translation that won't be used. It needs to be efficient and useful for everybody. So yes, I've thought of it. I'm not there yet quite exactly, but the Living Lab is always in the back of my mind because this is so important.
Thank you. So I'm just going to throw in the chat Catherine's email address. I think she also shared it at the end for anyone who wishes to reach out to contact her. Feel free to contact her. We are also going to put the recording as well as a policy a presentation on our website as well as AGO's website. So feel free to follow up later if you need. Thank you so much for this presentation, Catherine. I'm going to reach out to you on the other side in the emails.
Thank you very much for having me today. It was a pleasure. Thank you so much.
Thank you. Bye.
Bye.